Dear colleagues, we continue our working. Then I would like to invite Alexander Kvitashvili, the Minister of Public Health of Ukraine, will be talking about the details of the vaccine public procurement in 2015. Good morning. We are starting every week weekly meetings with you, communication with you to provide information on what's happening in the system of public health. The first mini report that I would like to present here is the situation with vaccines. Why? Because today at the Verkhovna Rada, the draft will be registered, which will allow the country to procure vaccines via UNICEF, the UN Children's Fund. We all know that the situation with vaccines in Ukraine is very difficult. The reserves are not very big. And we know that in Ukraine, every year, there are about 500,000 children born, and the necessity is to have 1 million, more than 1 million different vaccines, and talking about money, that's about $23 million that we need annually to ensure vaccination of all newborns, and we have to cover all the needs that exist, because the vaccination hasn't been fully done starting from 2011, and also we need to have reserve of vaccines in the country. We worked very intensively with UNICEF. The group of consultants arrived and they were working on these issues. We were given very specific recommendations, very specific figures, and again I would like to mention why we need this law, which will allow the country to procure vaccines via UNICEF. For example, today in Ukraine, and out of 15 registered vaccines, UNICEF can bring 8, but 4 out of these 8 have not been registered, so that means only 4 can be imported via and can be procured via UNICEF. If we did it last year, we could have saved $1.5 million for a year, and that is a lot of money when we are talking about vaccines, and that means that we would be able to buy more vaccines and cover more children. So the transfer to procure the vaccines via UNICEF is very, very important. And myself, as the minister, as the citizen of Ukraine, and as the patriot of Ukraine, I just request the parliament to pass that law, and so that we can do it. According to that law, we will be able to procure other medications via international organizations, UN organizations, the World Health Organization, UNAID, and others that will help us procure high-quality medicines at a good price. And what is the most important? We'll have a schedule. We will not just buy on July when there's an emergency, for example, but we will have a very good schedule. So basically, by that we are removing the corruption component, and also we get what we need, the numbers we need of high quality, and when we need. But also it is important to open to help in registration the companies that are bringing in vaccines, to make the market more competitive, so that UNICEF can work with other importers, and that is very important for us, and we'll be working very intensively on that. But we need the green light from the parliament. the law that has to be passed. And that is all. We will have many more briefings. I will come here often and I will be telling about some of the procurements. If you have questions, please, 1+1 channel. Could you please tell, we'll be procuring 4 from UNICEF, 4 will be registered, and will we be also procuring them from UNICEF? And what about the rest of them? Where will be procuring them? Will there be registration of some new ones, European? Today, based on the fact that only 4 vaccines which UNICEF can supply to Ukraine are registered, then the first procurement will be of these 4. We'll be working with the producers because according to this law of Ukraine, which is currently effective, only the producer can register the medicine, the preparation, the vaccine, and we'll be working with them so that they can register. And we'll be trying to move to the standards of UNICEF procurements. As to those which we cannot procure via UNICEF, we know exactly how much we need, and we will be organizing open, transparent, very civilized standards, which will allow us openly, I would like to emphasize openly, in online mode to procure high-quality medications that we need. For that, we need also changes, but these are not legislative changes. These are the changes inside the ministry, and we are working on that. We have all the information on numbers, and naturally will be this will be based on the need, how many vaccines we need. We understand that we do not have enough money, but we are working with the international organizations and will be covering the gaps, possible gaps with their assistance. There is such a precedent with polio vaccines. UNICEF will be bringing the vaccines worth $3 million as a humanitarian aid, and that is 7.5 million doses polio vaccines, and that is what we badly need. If the law is passed in the nearest future, when can we expect to have the procurement? Because now there's shortage in all the regions. When there will be the first procurement? When will you procure the first vaccine again? If the law is passed in March, then we'll be able to immediately start procurement. A few weeks will be needed to change the bylaws, the regulations that we need. And mostly, as the practice shows, UNICEF needs about 6 weeks to import. But the vaccines, that is not that we need to procure everything and bring it one day, because children are not born one day. We'll have a special schedule. After the law is passed, a month and a half is the maximum time needed for us. Also, the vaccines which you are planning to procure via UNICEF, who are the producers of these vaccines? And talking about the vaccine, TB vaccine, 80% of that was produced by Russia. UNICEF is not procuring vaccines for one country only, for Ukraine. They are procuring vaccines for more than 100 countries. All these suppliers have been working for many, many years in the market, and they are all checked and will be using the vaccines from companies that have been working with the UNICEF for many years. But of course, we can find alternative to that.
I don't know the standards. they were using for sanctions in the past. I'm sure that by quality and price, alternative to Russian vaccine will be found easy all over the world. As you know, for many vaccines, there is a temperature corridor who will examine delivery of vaccine. And during the last press conference in the Cabinet of Ministers, you spoke about Kharkiv vaccine, and children die because of them. Will Ministry of Healthcare raise the issue of examining those vaccines and finding responsible for the deaths of kids if they violate abuse elementary rules of preservation? That is not the issue of for Ministry of Healthcare, but the issue for police. It's a criminal. It's a criminal case, and I'm not. It's not for me to decide there. But there is other capabilities in the country to preserve, and cold chain, which was built. And we should check it once again. And when we bring all vaccines, we will see how adequate that network is. Otherwise, they will just be spoiled quickly. So we'll make a revision of the cold chain. Who will? You want names? Ministry of Healthcare is responsible for vaccination, and the government is responsible. That's why we'll control the quality of the network, of cold network, and which will have to work in the country, and also delivery and later exploitation. Thank you very much, Minister. I know that you have to go to the next minute. Colleagues, we will invite Mr. Kvitashvili in a week. I see that there is interest and there are a lot of questions. The Minister